foremost, I have been having a series of meetings with representatives of the international community to provide the thinking of the main opposition, which is the Samavijana Balavedi, from a political vantage point. I have been expressing the grave concern that we have right at this present moment because of the increase in the numbers as far as COVID patients are concerned, and we in the opposition have made an effort to appeal to the international community to provide as much support as possible to ensure that all steps are taken, all avenues are followed to neutralize the COVID threat. Right now, there is a growing demand for ICU beds, ventilators, oxygen-related machines, a necessity for field hospitals, which can be, those are called flexible field hospitals, which can be moved from one location to another. The present health structure is facing enormous challenges with the increase in the number of patients. Some hospitals are virtually overflowing. There is another issue that has cropped up, that is patients with various other medical issues who have non-communicable diseases are also impacted because the hospital beds are already taken. So these are the various health-related urgent facts, and I want to emphasize to you too the resolve of the opposition to provide the fullest amount of support in countering this menace, and we appeal once again as an opposition to UNICEF and to all other international agencies to provide as much support in the areas that I just put forth. And I'm also concerned that a new phenomenon of poverty has emerged with this COVID crisis. If I remember correct, there was a report either by UNICEF or by a related UN agency sometime in May 2020, which illustrated the fact that 30% less money is being spent on food items. I hope I'm correct.
You're absolutely correct.
Right.
You remember it well.
So, if anything, I personally think that the situation has worsened, and there's a more exacerbated situation right now, and I'm very keen to find out your take on this new poverty phenomenon, COVID poverty in Sri Lanka and also worldwide, and what steps should we as public policy decision makers take to try to alleviate COVID poverty. So that's also an area which I'm very interested in. And at this time of COVID pandemic, what are the special steps that we as a country should take to enhance and promote child health and maternal health? Because we as a political movement face a very high premium on promoting and protecting the mother's and the child's health. Just for your information, I was the health deputy minister some time ago, 2001 to 2004.
Okay.
And that precipitated my interest in the preventive healthcare system. We always hear prevention is better than cure, it's true. But I do have a special bias in favor of the preventive system. Not that I want to neglect the curative system, because the curative system right now has become one of the biggest public health emergencies and issues. So these are the issues which I want to talk to you about. First and foremost, I mean, whatever UNICEF can do for our country in terms of combating this COVID menace, please, we want to make a very humble appeal to provide as much as possible support to strengthen our health sector.
Well understood, and please know that honestly, even the three of us connected, this is Ruthie, who's our Chief of Operations, and Bismarck, who is our Chief of Communications. The three of us, but also the broader team, it is our number one priority, is supporting the government's response to COVID. As you rightly mentioned, it's a menace everywhere, and yet Sri Lanka's fared relatively well because you do have such a strong health system. You know, the preventive and curative aspects come together all the way from top to bottom, and I think that's served the country very well over the last 12 to 18 months as this has rolled out. But of course it's not gone away, and just as we hoped that vaccines would become available and so then the menace might diminish, of course that became more challenging with the surge in cases in India. So throughout the last year and something, and in particular the last couple of weeks as we've seen the increasing cases here, really supporting the procurement efforts is where we put a lot of emphasis, in addition to trying to mobilize our donors globally, but also here to support. So most recently, the Australians have stepped forward to support the oxygen procurement, for example. But you know better than I do that more is needed, and so just trying to galvanize people. It's difficult when we've been doing this for a year already. You know, donors, there's a certain amount of fatigue there, and also because the needs are so broad everywhere, it's extremely difficult. That families have had to pawn items, they've had to sell items, they've been able to buy less food for children, and that then triggers a whole series of implications for young children. In particular, what I am concerned about is the nutritional status of children, because unfortunately Sri Lanka has high levels of wasting when a child is low weight for their height. Sri Lanka is currently 9th worst globally and 3rd worst in the region. And we know that when families have less money to buy nutritious food, those children will slip further backwards. And so we see that as another dimension of the emergency that will come, even if it's less obvious to the media, less out in the sort of the spotlight, but nevertheless it will severely impact those children and the human capital that they also offer the economy of Sri Lanka. So these are challenging times, absolutely, but certainly from the UNICEF side, to date, in addition to the procurement support with the Ministry of Health for some of the equipment, for oxygen, for ventilators, a lot of the work that my colleague Bismarck is leading with the Health Promotion Bureau is around the communications. Because while we are sitting here in masks, keeping the distance, it's important that everybody does. That everyone realizes just because you've got the vaccine doesn't mean that we are out of this. We still need to be careful because different variants will come. And if we try to go too quickly back to normal, then we'll likely see ourselves in difficulties again. So the communication aspect is incredibly important and will remain so, I think, for quite some time. But hopefully with the approval of and now the rollout of both the Sputnik vaccine and the Sinopharm approved by the NMRA here, hopefully that will begin to see or to support the response that we have. Obviously you still need the access to the health facilities as you mentioned, but maybe that will begin to reduce some of the transmission rates as well, so the system as a whole can take a breath and actually catch up, because there will be so much demand placed on it.